This is the last but one tutorials on 2015 Booklet, Krok 2, 2015. All right, so let us begin. So we have a 5-year-old child who has body temperature risen up to febrile numbers. Suffers from inertness, weakness. Examination revealed hemorrhage on the skin of the limbs and the torso. Hemorrhage, that's bleeding. There's enlargement of cervical and axillary lymph nodes. They can all be detected. The liver is 4 centimeters below the costal arc. Spleen is 6 centimeters below the costal arc, meaning there is hepatosplenomegaly. Blood analysis is showing 2.3 times 10 to the power 12. Hemoglobin is 60. This is quite too low, if you ask me. Platelets is also quite low. Leukocyte is quite high. Eosinophils 1%, band neutrophils 1%, segmented 12%, lymphocyte 46%, monocyte 1%. Look at the blast cells. Blast is 40%. 40%. Duke's bleeding time test result is 9 minutes. What examination is necessary to make the diagnosis? Please, can Parry call Nene? I don't think Nene is around, so someone to call Nene. All right, what examination is necessary to make this diagnosis? So, of course, with the increase of WBC, and you know WBC is not specific to a particular kind of cell. It simply means that all the red blood cells are quite high. So with increased WBC and lymphocyte 46%, we can think of a problem of what? Leukemia of lymphoblastic type. Lymphoblastic type, because we're having a blast of 40%. So that means more of the blast could be made of what? Or could be coming from the lymphoid origin. So we are having what? Leukemia of lymphoblastic type. Lymphoblastic type. And usually, lymphography should be the ideal test to do to specify the diagnosis. Lymphography. However, we can also use what we call myelography. So this one, is going to check inside the bone marrow itself to look for what is causing the problem. What is causing the problems. And that's why maybe over here, Krok decided to use what? Myelography. But on a normal day, I would have gone for what? Lymphography. I said I because it's subject to be reviewed, and to be discussed by you guys all. All right. So basically, your answer here should be what? Should be A. Myelography. All right. A child from primipregnancy was born in a term labor. That means due labor, term labor, and has body weight of 400 grams and body length of 57 centimeters. 57 centimeters. Now, we've already established the normal body weight of a baby around 2.6 G to about 3.5 or 3,500 grams. But here is a kid, we're having what? 4,000 grams. So this means that the baby is quite what? Big. Now, when born, he was non-responsive to examination. Non-responsive to examination. And you guys can tell that one of the causes of giving birth to a macrosomic or a big baby is asphyxia, isn't it? Asphyxia, that means difficulty to sort of breathe and things like that, asphyxia. And again, one of the complications too is having what? A shoulder dystocia as one of it too. And shoulder dystocia can also lead to paralysis, either the upper or the lower paralysis of the arm. Let me put it that way, of the arm. You know all of these in the Erb's palsy and then stuff like that. That's just by the way. Now, diagnosis is diffuse. Heart rate is 80. What resuscitation measures should be prescribed? what resuscitation measure should be prescribed. So you need to understand what resuscitation is. And it is simply the process of correcting physiological disorders. Correcting physiological disorder in an acutely ill patient. So by correcting physiological disorders, we are referring to what? Things like breathing or heart rate. When there's difficulty in breathing or there's arrhythmias and things like that, or heart problems, basically. We do the resuscitation measure, or we do that process to revive the person. And now, over here, they are saying that when he was born, he was non-responsive to examination. Non-responsive to examination. And this means that postnatal check was absent. Postnatal check was absent. I'm saying postnatal check was absent because we have a similar question like this that we solved in one of the gynecology or pediatrics question. Okay. They didn't say the person was non-responsive, but they said postnatal check was absent. That's why I'm bringing it in. So that when you see somewhere else, you don't say that BAHA did not tell me or we didn't discuss it. It's the same thing. It simply means that postnatal check was absent or non-responsive to examination. And we said because the person is non-responsive to examination or postnatal check was absent, what we do here is what? We do artificial lung ventilation with a mask. Artificial lung ventilation with a mask. So here, your answer should be what? Should be C. That's AVL. Begin AVL with a mask. Artificial lung ventilation. So your answer is C. All right. A 20-year-old patient was delivered to a surgical unit complaining of an incised wound on his right forearm that has been bleeding for 1.5 days. 1.5 days. Suffers from general weakness, vertigo, cold sweat, apoptosis, skin and visible mucous membranes are pale. Heart rate is 110 per minute. BP is 170. Blood test is hemoglobin is 100 grams per liter. Erythrocyte is 2.5. What is the cause of the patient's general condition? Patient's general condition. And over here, they said this person was in the surgical unit with an incised wound and he has been bleeding for 1.5 days. And this is enough to cause what? Anemia. And this type of anemia, we call it what? Post-hemorrhagic anemia. Post-hemorrhagic anemia. And this is of chronic type. It's of chronic type and it develops after long, repeated, slow blood loss. And normally you can find it in people with cancers, hemorrhoids, gastritis, cancers, people who uses NSAIDs, menstruation, and trauma. Do you understand me? And sometimes if the bleeding is so on the spot, if it's on the spot, that person is bleeding profusely on the spot. The person was bleeding for 1.5 days. That means whatever bleeding it was not severe. That is why they didn't apply or they didn't try to stop the bleeding. But imagine you are bleeding profusely. Definitely medical attention will be rendered to you, isn't it? And in that case, we could have said we're having what? Acute post-hemorrhagic what? Anemia. But this is what? Chronic post-hemorrhagic what? Anemia. So whichever be the case, we are still in the right answer. So over here, your answer is what? Post-hemorrhagic anemia. Post-hemorrhagic anemia. But it is more of chronic than acute because of at least more than 1 day. All right. A 20-year-old parturient woman has the first labor stage. The first labor stage. Who can tell me the stages of labor? Quick, anyone? How many are they and what are the stages? Anyone, quick.
There are 4.
Four. Four, continue.
3.
Come again?
I can only remember 3. Cervical effacement / dilation. Uterine thinning. No. Cervical effacement and dilation. Expulsion of fetus from the uterine cavity. Then expulsion of what they call that. Expulsion of
placenta.
placenta.
Okay, so basically, we have 4 stages of labor. Write it down. 4 stages of labor. In stage 1, it is divided into 2. In stage 1, we have the latent, and then we have the active. Stage 2, yes. Now, that is, so both stage 1, the active and then the latent phase in stage 1 basically is talking about what? Effacement and dilatation of the cervix up to at least 10 centimeters. Then we have the stage 2, whereby there's expulsion of the fetus. Then stage 3, we have the expulsion of the placenta. Then in stage 4, we have the recovery stage. So please don't mix.
But Dr. BAHA, you said stage 2 is baby delivery in one of your notes.
Stage 2 is baby delivery. Stage 1 consists of 2 periods or two phases. Let me put it that way. So we have the latent phase and then we have the active phase. Now, in latent, we are dealing with what? Effacement. That is thinning of the cervix. Then in, the active phase, we are basically dealing with what? The enlargement or the dilatation of the cervix from 4 centimeters to about 10 centimeters. I hope it's clear now. So let's continue. Now, the question says that this person is in stage 1. So again, why I'm saying this because it will help you to analyze the question best. So stage 1, stop thinking about stage 2, stop thinking about stage 3, stop thinking about stage 4. So this is stage 1. Now the pregnancy is full term. Labor occurs every 3 minutes and lasts for 55 seconds. Fetus presentation is polar. The head is pressed to the small pelvis entrance. The heart rate of the fetus is 150, distinct and rhythmic. Vaginal examination, the uterus is smooth out. So that's thinning. It's smooth out. That's effacement. It's smooth out. Mouth of the womb is 2 centimeters open. And we said in latent phase, we don't have it. We have it up to 4. Now in active phase, it's from 4 to about what? 10. Now the fetal bladder is intact. The head is presented over the first plane of the small pelvis. Moderate mucous-bloody discharge is observed. What phase of the first labor is this? So again, if you know the stages, it helps you to know your diagnosis. So just simply put, this is what? The active phase of labor. As simple as that. So your answer is E. Don't get confused with this question. If you get it wrong, I'll enter your exams room and I will ship you.
Dr. BAHA, you just made a mistake.
Dr. BAHA, isn't it
What did I say?
Dr. BAHA.
It's latent.
It's latent, yes.
It's meant to be B.
It's latent, not active. It's latent. Why? I said active,
Yes.
Yes.
but my explanation is telling you that this is latent. So why are you fighting with me? Thank
Because
you.
you said active.
Okay. At least it means you are following, which is good. So I'm happy you are following. So the answer is E. All right. A 23-year-old woman, after stress, has developed test, polydipsia, polyuria. Guys, what is this classic for? Very quick. What is it classic for?
Diabetes mellitus.
Diabetes. Thank you. So let's continue. Thank you. Let's continue. So we have weight loss, increasing fatigue. Later, she developed nausea and somnolence, loss of consciousness, and was hospitalized. So there's loss of consciousness. So that's coma. I don't know whether it is hypoglycemic coma or hyperglycemic coma or ketoacidotic coma, whatever it is. Now, glycemia is 27, so definitely glucose is high. Guys, look, acetone in urine is sharply positive. The treatment for ketoacidotic coma was initiated. So again, they've told you your diagnosis. This is what? Ketoacidotic coma. Why? Because of the presence of acetone bodies or acetone in the urine. Okay, and I've established here countless number of times that the fact that you are having hyperglycemia doesn't mean that you have developed ketoacidosis. Thank you. It doesn't mean you have developed ketoacidosis. You can have what we call hyperglycemic coma, which is different from ketoacidotic coma. This is just, by the way, to just add up. Now, when will it be advisable to start a preventive treatment of hypoglycemia by introduction of 5% of glucose solution? When will it be advisable to start preventive treatment of hypoglycemia? Hypoglycemia by introduction of 5% glucose solution. What it means is that at what point when the glucose is high will you initiate or will you start giving insulin? As simple as ABCD. Simple as ABCD. And of course, when the glycemia is more than 12, in Ghana, it's more than 11. In Ghana, we say more than 11. More than 11. Ukraine is saying 13 to, how do you call it? 14. Okay. So when at that level is high, we have to what? Initiate, what do you call it? Insulin giving. And again, you can remember the dose of insulin, right? Per kg. Who can remember? 0. What?
0.1 to 0.2.
Good. Per kg. Every what? If I'm correct. So that is what you need to do. So, but I don't know why they are saying that hyperglycemia rate drops to 13. I don't know I don't understand what they mean by that. But basically, it's supposed to be around 13.
They mean if you monitor the patients, at least once it drops then to 13 to 14.
14. Fantastic. Oh, guys, look at it. The question is, when will it be advisable to start preventive treatment of hypoglycemia by introduction of glucose? Like I said, for introduction of insulin, yes, around 11 going, but when you begin to realize that now the glucose is dropping, at what point should you start giving glucose to at least make sure that you don't have a drastic decrease of glucose? Yeah, that's the question. A drastic decrease of glucose. So you have to treat hypoglycemia. So that is the right explanation to this question. So here, your answer is E, which is absolutely correct. Absolutely correct. All right. A 53-year-old woman complains of weight loss up to 10 kg. 10 kg within the last 2 years. I know many of you will start thinking of a cancer, which you are not far from right. One of the causes of unexplained weight loss is, how do you call it? It's cancer. So, yes, it's at the back of your mind, but keep reading. Maybe you might have a different perspective to this question. Now, they said there's what? Liquid foul-smelling stool 2 times a day that poorly washes off the toilet, periodic bouts of nausea, girdle pain in the upper abdomen. Girdle pain in the upper abdomen. Guys, look at there. Look, objectively, what can we find? We are having Gumbengrit zones and Mayo-Robson point. Guys, when we talk about Mayo-Robson point, what disease comes to mind? We have discussed it countless number of times. What?
Pancreatitis.
Pancreatitis, exactly. Pancreatitis comes to your mind. So even if you don't know, for the fact that they are saying that there's Mayo-Robson point present, please, pain is there. Know that you are thinking of a problem with the pancreas. But let's continue if we can have additional information to back up with your provisional diagnosis. Now, they say biochemical analysis reveals glucose to be 3.2, bilirubin level to be 16.5, crude protein to be 56, urine diastase to be 420, blah, 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 blah. Ziglos test, that is administration of Ziglos, whatever, after 5 hours reveals 3 grams of Ziglos in urine. The most likely diagnosis is what? So definitely, by what I've just explained, by what I've just explained, we are saying that anytime we are having, how do you call it? Mayo-Robson points being positive, definitely we are looking at a problem with the what? With the pancreas. And again, the urine diastase is useful in diagnosing of uncertain abdominal cases, like when pancreatitis is suspected. When pancreatitis is suspected. And usually it comes from a case of chronic pancreatitis. Chronic pancreatitis. So over here, without even going details, we know that we are having a problem with the pancreas. And so therefore, your answer should be pancreatitis. And of course, it could be due to malabsorption And of course, in addition, we have what? Malabsorption syndrome. And that could attest for the fact that we're having what? A significant what? Weight loss. Because if you don't eat, definitely you are going to have weight loss, significant weight loss. So that can confirm our answer for us as well. So your answer here is what? Is A. A 23-year-old patient, after intake of brake fluid, has developed anuria. That means absence of urine. And we said absence or decreased urine is a sign of what? Who can tell me? A sign of what? Quick. Oh.
Acute
I
urinary.
don't know.
Urinary what? Failure. No. Kidney failure. Yes.
Renal
Kidney failure. That is what comes to mind. And when you think of kidney failure, we establish it countless number of times that to, how do you call it? To help this patient, either you do what? Hemodialysis or you do what? A transplant. But in most cases, we'll prefer the hemodialysis because it is easier compared to the transplant. And in transplant, it's when it is too severe that hemodialysis will not be able to work. That's when we go in for what? For kidney transplant. So again, over here, we are going in for what? For hemodialysis. Because again, creatinine level has increased. And creatinine level is not supposed to be in your blood. Here's the case, it is increased. That means that there's decreased glomerular filtration rate due to kidney damage by the intake of this brake fluid. So even if you don't know what brake fluid is, you know that this is what is causing the kidney failure. So your answer is A, hemodialysis. Sorry if I'm moving too fast, but I'm just enjoying myself. A 15-year-old teenager has undergone medical examination in a military recruitment center. The following was revealed. There is interval systolic murmur at the cardiac apex, ascent of the second heart sound over the pulmonary artery, and there's tachycardia. What additional examination will be most informative for determining the diagnosis? Again, what instrument do we do? I mean, what procedure do we do for people having heart pathology? Mention two.
Echocardiography.
Echo and what?
Electrocardiography.
Yes. Or good. So ECG, that's electrocardiography, or the echocardiography. These are the two tests that you are going to what? You are going to do. But if you want to look at the vessels and things like that, what do? You're going to do what? Echocardiography. Echocardiography. So basically, ECG basically is not present, or electrocardiography, though electrocardiography is present, we could also mean ECG in a way. But if you want to look at the valves of these heart chambers, you will want to what? Use echo. It is more informative. Echo will be more ideal. All right. A 64-year-old patient has been hospitalized with complaints of a progressive jaundice. Again, we have three types of jaundice. We have prehepatic, hepatic, and what? Post-hepatic. We've discussed it. And in post-hepatic, the color of the feces is what? Colorless. That is just by the way. They say it has developed over 3 weeks ago without pain syndrome. General weakness, loss of appetite. Temperature is 36. Heart rate is 78. Abdomen is soft and painless. Guys, peritoneum irritation syndrome are not detected. That means signs of peritonitis is absent. But look at it. It's a palpation revealed a sharply enlarged, dense gallbladder. So what disease can be characteristic with these, symptoms? The gallbladder is what? Enlarged. Come again?
No, I'm talking.
Okay, good. Is enlarged. Now, I know, let's kindly mute our microphone. Good. Now, I know many of you are going to be thinking of what? Cholecystitis. But there's something you are missing over here. Now, in cholecystitis, there will be the presence of what? infection, temperature will be there. Temperature will be there. But look, objectively, temperature is normal. 36.8 degrees Celsius. It is normal. So the absence of febrile temperature and, of course, the negative peritoneal irritation will definitely rule out any source of infection. And so, therefore, you are going to be thinking of what? A tumor or a cancer. A tumor.
As well as the absence of pain.
And Dr. Baha, sorry, because it says painless as well.
It's painless.
Good. It's also what? Painless, without pain. Exactly. Thank you for bringing my mind on it. Without what? Pain. In society, you might be thinking of what? Pain and all those kind of stuff because bile is trying to be secreted, and so therefore pain will be elicited around that area. But here, there's no pain, no temperature. So immediately just rule out the presence of what? Infection. To be specific, cholecystitis. So therefore, you are thinking of what? A tumor or a cancer. And obviously, we are going to be looking at for what? The cancer of the head of the pancreas. Cancer of the head of the pancreas. Cancer of the head of the pancreas. And again, I will entreat us to go and look at the anatomy of the pancreas. Look at where the head is located for more elaboration. So over here, we are going to consider what? D as our answer. D will be our answer. All right. So if you are enjoying this, remember to subscribe to this channel so that you don't miss any video that we post over here. Okay. A 22-year-old woman on a reduced diet, vegetarian, attended a hospital with complaints of a distorted smell and taste perception and lesions in the angles of her mouth. Sclera is distinctively blue. They didn't make it a diagnosis. Diagnosis is what? Iron deficiency anemia. Iron deficiency deals with what? Iron. So what clinical syndrome is expressed primarily in this patient? Of course, if you're talking about iron, you are talking about what? Sideropenic. Exactly, sideropenic. Ladies and gentlemen, don't confuse yourself with some of these easy bonus questions, all right? So here, we are looking at what? Sideropenic. And again, this is also called plum-sized syndrome. So you can Google it and go and check it out. Plum-sized syndrome. Plummer. Vincent. Vinson. Syndrome. So look at it at your own free time. So again, your answer is C. A 15-year-old patient complains of excessive body weight. Headache is present. This is 15 years old. Headache is present. Irritability, rapid fatigability, significant increase of body weight occurred at the age of 14. Weight is 90 kg. Height 160. Proportional to the body built or to the body. Fatty tissue is distributed evenly. There are 10 pink striae, that is stretch marks. I know Uche loves this question very well because he knows everything about stretch marks. On the thighs, abdomen, and mammary glands. BP is 140/90. Provisional diagnosis is what? So Uche, what's your answer? Quick.
Cushing's.
This is where we're going to have a problem. Now, this is not Cushing. I know you are tempted to say this is Cushing, but look at the age. Yes, this is what 15-year-old patient. 15-year-old. Exactly. Good. So you are definitely thinking about what? About the pubertate dispituitarism. And of course,
why, sir?
Good, relax. I'm not done. All right. So obviously, yes, you are right to say you are thinking of a Cushing syndrome because they all comes with the fact that there is what? Stretch marks on the body and things. There's increase in body weight. Sometimes they even add moon-like face and all those kind of things for you, which of course it is absolutely what? Correct. But again, look at the anamnesis of the patient, the history of the patient. The age is not there for their sake. This person is a child, not a child per se, but it's a baby. For all you know, maybe this person has not even, how do you call it, had her menstruation and things like that. Okay, this person might not have had her menstruations and things like that. For all you know. And that is why over here, based on the history that we are having in this patient, we will not say this person is having, how do you call it, Cushing syndrome or Cushing disease. Of course, I know by now you know the difference between Cushing syndrome and Cushing disease. Cushing syndrome is simply signs and symptoms of what? High cortisol levels. What Cushing disease has to do with high cortisol level due to pituitary gland enlargement or tumor of the pituitary gland. That's the difference between Cushing disease and Cushing syndrome. But then again, over here, we are going to consider the pubertate this Master. Answer is D. Case closed. Before I bite my tongue. So your answer is what? Is D. D will be our answer. D will be our answer. It is more appropriate. Yes, the rest are differentials, but more appropriately, your answer is D. All right. A 6-year-old child attended a general practitioner with her mother. The child complains of burning pain and itching in her external genitalia. The girl was taking antibiotics the day before due to her suffering from acute bronchitis. Okay. On examination, external genitalia are swelling. Guys, now you know the difference between, now they are saying what? External genitalia. They're not referring to what? To the lips. They're not referring to the lips. I'm saying this because we had a question, one of our presentations, and one of you was asking, why is it not vulvovaginitis? But over here, we are talking about the external genitalia, external, not specific to the lips. If it is to the lips, then you are thinking of what? The Bartholin's glands to be affected. Aha. So now you have seen a question that can exactly differentiate between them for you. They are saying that it is swollen, hyperemic, white deposit accumulated in the folds, the most likely diagnosis you are looking at for. And again, white deposit. Ladies know this condition very, 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 very much. They know Candida very, very much because they come with a creamy or a whitish discharges. So usually ladies, they know this very, very well. And again, I've given differentials between all of these things in our gynecology basis. I've given differentials between them. For example, in bacterial vaginosis, we said the color is what? It has a fishy odor without itching and burning. And it has what we call clue cells. Clue cells. And again, the presence of this fishy odor, the test they use to, say it's positive, is what we call the whiff test, WHIFF, then test, whiff test. Then in Trichomonas vaginitis, we are basically talking about a vaginal discharge, which comes with itching, burning, and pain during intercourse. And usually the discharge is frosty and green. Frosty and green. So, yeah, basically, this is what it is. And of course, our right answer here is what? Is candidal vulvovaginitis. Why? I've already explained. So the answer is B. A 44-year-old man complains of dyspnea with sensation of lack of air on inhalation. Inhalation. Palpitation occurring during slight physical exertion. So what comes to your mind could be a pathology of what? The heart. And they are saying that the sheen edemas that appear in the evening and resolve in the morning. Again, it goes on to confirm that you are having a problem. You could have a problem with the heart. His condition has been lasting for 5 months. Deterioration is gradual. What method of instrumental diagnosis allows to verify? They even told you what to do. To verify decrease of systolic function. Decrease of systolic function. So valves. So don't go and say I want to do ECG. No. ECG deals with what? Electrical activity. But systolic function, it talks about the valve. So you're thinking about what? Echo. So here, your answer is what? Echocardiography, as simple as ABCD. All right. When playing in a kindergarten, a 3-year-old child suddenly developed dyspnea. Already, you know the answer even before I continue. Proximal compulsive dry cough, face is cyanotic, eyes are tearful, vomiting occurred several times, breathing is weakened over the whole right side of the chest. The provisional diagnosis should be what? What are they thinking about? 3-year-old child. Difficulty breathing. What are they thinking about?
Bronchitis.
Come again?
Foreign
To lash you. Foreign body aspiration. Foreign body aspiration. Playing in the kindergarten. Sometimes they will say playing in the, is it pen or something like that, or playing with the children or something like that. But basically, children like to put the toys inside their nostrils, like Fifi was doing, like Uche was doing when he was young. Even now, he still do it. That was just by the way. So your answer is what? Foreign body. So Uche, stop putting things in your nose. And which part of the heart, of the chest, is it likely to enter? Which part? Who can tell me? And why? Quick.
Trachea.
You said it was the right bronchus or something like that.
Why?
Because of the position. It's more, as compared to the other bronchus.
Good.
It's more direct. So it has like a much linear route.
Fantastic. So the bifurcation of the trachea on the right? Yeah. On the right is more should I say perpendicular? No. It's more how do I read? Because the English I'm talking
linear.
It's more what linear, right?
Linear, yeah.
Okay.
Direct
Or it's
or
more
linear.
straight. Let's put it that way.
Mm-hmm.
All right, please. The English is not my language. Forgive me. But A should be your answer, not bronchitis, please. All right. A patient with autopyosis is in sharply deteriorating condition. When we say auto, the word auto means what? Ear. Pyosis means what? Pus formation. So simply put, the presence of pus in the ear. That's how to analyze a question. So there's autopyosis is in the person is in sharply deteriorating condition. He developed headache, vomiting, febrile temperature, general hyperesthesia, meningeal symptoms, and stagnant optic discs are observed. They are observed. Again, who can tell me 3 differentials of meningeal symptoms? Or 3 differentials for meningeal symptoms? 3 differentials, please. Quick.
Encephalitis.
Come again?
Encephalitis,
yes. People are talking, you stopped. Why? Meningitis. Pressure in the brain. Mention them. Are you guys afraid? Meningitis and meningitis, we have different types of what? Meningitis. And how do you analyze somebody with meningitis? We've said it over here like a dozen times. Lumbar puncture. And what are you looking at for? What fluid are you looking at for?
Lumbar puncture, if it's yellowish, it's bacterial.
No, I'm talking about what liquid are you looking at for? What fluid? You are checking the CSF, exactly. Also known as the liquor. So the characteristics of the liquor or the CSF will tell you the specific diagnosis you have to look out for. As simple as ABCD. Good. So now let's continue. So they're saying that there's no focal symptoms. Liquor is turbid. That is the CSF. Liquor means CSF. Is turbid. Blood pressure is high. Albumin occurs with neutrophils. And neutrophils are signs of what? Bacterial meningitis. Exactly. bacterial infection is occurring in this place. And again, they have even given you another history. So then this thing could be coming from the ear, okay? Because already they said there's a pus formation. You know, pus has to do with what? With bacteria, isn't it? So even without more information on the liquor, you can easily tell that this is a bacterial infection. And of course, is it primary or secondary? And of course, this meningitis is occurring because of the autopyosis. And that's why we call it what? A secondary purulent. Purulent means pus. Purulent what? Meningitis. Either purulent or suppurative meningitis. They all mean the same thing. They all mean the same thing. So again, if you understand your mechanism and diagnosis, you have no need to, this question is just bonus. Your answer is C. All right. A 25-year-old patient is not married. Fifi, look fast and get married. Uche, marry fast. 25-year-old patient is not married and has sexual relations. Oh, why people doing me like this now? Me, I'm married now. With a lot of women, they know themselves. Now, 25-year-old patient is, Uche, what's your problem? Are you just that I'm married to beautiful ladies? A patient, 25-year-old patient is not married and has sexual relations with several partners. Uche, stop this thing. It won't help you. Uche, Nene, and Fifi, stop these things. Now, during the last 3 months, he noticed a small amount of mucocerial secretions produced from the urethra. Subjectively, periodical itching or burning pain in the urethra. Subjectively, that's what the person is telling you. 2 months ago, there's pain in the knee. Is it knee joint? Knee joint or knee joint?
His knee joint.
Developed. Possibility of trauma and exposure to cold is denied. Now, exposure to cold, you could be thinking of what? This is Dami's favorite question. You could be thinking of what? Pylo, isn't it? But they say it has been denied. Now, during the last week, eye discomfort is noted. Lacrimation and itching is there. What provisional diagnosis can be suggestive? Now, obviously, we are having what? A rheumatology case, isn't it? A rheumatology case. So anytime you get a rheumatology case like this, which is accompanied with uretritis, that's inflammation of the urethra, uretritis. Medicine is not easy. Uretritis or cervicitis. Please, you are thinking of what we call Reiter's syndrome. Reiter's syndrome, also known as reactive arthritis. Also known as reactive arthritis. Don't go and say this is rheumatoid arthritis. No. This is reactive arthritis. Again, anytime you have a history of rheumatology question accompanied with infection or UTI, please think of Reiter's syndrome or reactive arthritis. Reactive arthritis.
May I add something that may help? How I remember Reiter's is can't see, can't we, can't climb a tree.
Come again?
That's right.
Can we what?
Reiter's syndrome. Can't see, can't we, can't climb a tree.
Wow. Now I'm lost. What's the meaning?
Meaning can't see uveitis, can't we your UTI, your symptoms, and can't climb a tree is the arthritis.
Fantastic. I've never thought about something like this.
Even Dr. Uche has a way of saying it.
I know. To be honest, I have no idea but thank you for that easy way to remember.
Dr. Uche says, can't see, can't pee, can't bend my knee.
Yeah. Wow. Can't see. Oh, please put it in the description. In the chat so that we can all have access to it. Okay. Fantastic. And thank you for that. And again, sometimes you can have the reality, I can't see the eye problem. So you've actually said it all. So thank you for that easy way of remembering. So your answer is yes, what? It's reactive arthritis. So thank you. All right. A 19-year-old patient complains of a severe pain in the axillary crease. Condition onset was a week ago after her swimming in cold river and epilation. The next day, painful boil appeared that was becoming larger every day and became plum-sized tumor. Upon examination, nodular conical growth joined together are detected. The skin covering them is bluish red in color. Some nodules have fistulous openings producing thick, purulent mass. Body temperature is 38. There is general malaise. What is the most likely diagnosis in this question? What is the most likely diagnosis in this question? Now, you can go for a carbuncle. Many of you are thinking of boiled for the presence of what? Boil. But you see, they've put it even in commerce or in whatever, English people do it. But they put them in carry commerce or whatever they call it. Okay? Or in notations, let me put it that way.
Yeah, inverted commas.
Thank you. English is good. So that's what we are having. And usually boil is known as what? A furuncle. Okay? A carbuncle are multiple boils. So we don't have multiple boils in this question. However, our likely diagnosis here to be what? Hidradenitis suppurative or suppuritis or hidradenitis, simply put, hidradenitis. And this is also known as acne inversa. And this is a long-term skin disease that is characterized by the occurrence of an inflamed and a swollen lump or swollen lumps. So basically, that is what this whole thing is all about. I don't want to go deeper and talk about so many things. But basically, that's what we are looking out for. And of course, like I said, suppurative, meaning it will release some pause, like in this question, for instance. All right. Okay. A patient complains of weight gain, chills, edemas, xerotherma, somnolence, difficulty with focusing. Height is 160, weight is 90. Body proportion are of female type. Temperature 35.8, heart rate is that. BP, heart sounds are weakened, bradycardia. Other internal organs have no changes. Thyroid gland cannot be palpated, that means it's not big. Mixed secretion from the mammary glands is observed. Hormone investigation, guys, this is your clue. Everything that I just said, it's going to say, not necessary, but this is your major clue. Hormone investigation revealed an increased levels of thyroid stimulating hormone, TSH, and prolactin, and a decreased level of thyroxine. So which one is the cause of obesity? Guys, they've already told you that there is a decrease of thyroxine. So definitely you are looking at what? You're looking at for what? Hypothyroidism. And this is primary because it is originating from the thyroid gland. Okay, so we are having a case of primary hyperthyroidism where there is low level of what? Blood thyroid hormone. So please, this is the reason. And of course, it can be classified as clinical. When diagnosed by some specific clinical features, such as mental slowing. Slowing. That is mentally, your brain is not working properly. Then depression, dementia, weight gain, constipation, dry skin, hair loss, cold intolerance, hoarse voice, irregular menstruation, infertility, muscle stiffness, pain, bradycardia, and so on and so forth. And so on and so forth. So it is classified as clinical when we see all of these symptoms. And of course, obviously, we are having such things in our question over here. So over here, we are looking at what? At C as our answer. C as our answer. Look at the temperature, 35.8. This is a little bit, low. Look at the blood pressure, a little bit low. Look at the heart rate, and everything is quite low. The person is dull, So the answer is C. The answer is C. And just to add up, thyroxine helps. Thyroxine is responsible for basal metabolic rate. And basal metabolic rate simply means the ability to carry out some normal functions of the body, like breathing, like other things and things like that. Charlie, it's okay. It's okay. Too much information is not good. So the answer is C. So you can find more of these on our Medent website, medentweb.com. I will put a link in the description so that at the end, you can just check it out to solve more questions and practice more. So let's continue. A 54-year-old patient complains of weakness, jaundice, itching of the skin. Disease onset was 1.5 months ago. 1.5 months ago. There's jaundice, there's itching skin, onset 1.5 months ago. Fever is 39, appear on the first with the progressive jaundice developed 2 weeks later. On hospitalization, jaundice was severely progressed. Liver cannot be palpated. Guys, look, the gallbladder is enlarged and painless. Enlarged and painless. Guys, can you think your mind to a question that you guys even prompted me about an enlarged gallbladder but painless? Exactly. That is the kind of condition we are having over here. So this could be a problem with the pancreas, isn't it? Yes. It could be a problem with the pancreas. Exactly. And when you have something like that, and of course, the type of jaundice, I explained it over there again, that we are having what we call an obstructive type of jaundice, or a mechanic type of jaundice. And again, I said the feces is colorless, or stool is colorless. Guys, medicine is so sweet. It's so sweet. So basically, that is what we are having in this patient. I don't know what they mean by stool is alcoholic. Please, it's not, how do you call it? Alcoholic. It's alcoholic. Alcoholic. It's typing mistake. It's alcoholic. That means colorless, basically, or white. White. Some books will say white. Some books will say clay. Some books will say colorless. Anyhow you want to pronounce it. Yeah, so the answer is what is A. Mechanical jaundice. Again, prehepatic, hepatic, mechanical. Please try and know the differences. Conjugated, unconjugated. We've discussed all of these things in pathophysiology and path morphology. Please do well to get the website and watch these videos. A 22-year-old patient complains of 8 months long delay of menstruation. 8 months long delay of menstruation. Good. Menarche since the age of 12. Okay, that means first menstruation was the age of 12. So that means this can be classified as what? A secondary amenorrhea, isn't it? Because the delay of menses. So secondary amenorrhea. Now, since the age of 18, menstruations are irregular. No pregnancies. Mammary glands have normal development. When the nipples are pressed, milk drops are discharged. Milk drops are discharged. Uche, don't worry, I won't go there, okay? Gynecological examination, there's moderate uterus. Hey, people. There's moderate uterus hypoplasia. Guys, look. Uterus hypoplasia, that means underdevelopment of the uterus. On hormonal examination, guys, look. prolactin level exceeds the norm. Prolactin levels exceeds the norm. What organ is responsible for the production of prolactin? Please, who can tell me? Quick.
Hypophysis.
Come again?
Gland?
Oh, I can't hear you guys. Yes, hypophysis. Hypophysis, the pituitary gland that is responsible for the production of what? Prolactin, or helps in the production of what? Prolactin. And again, look at it. On CT scan, celatusica, the pituitary gland sits on the celatusica like a king. Yes. A space occupying lesion 4 millimeters in diameter is detected. That means it is bigger than normal. So what are we looking over here? We are looking at a problem or a tumor of the pituitary gland. Exactly. By now, I know my lovely doctors know what a Sheehan syndrome is all about. Steen-Leventhal syndrome. You guys know it because we have discussed them like, is it 1,000,000 times? Yes, 1,000,001 times. I think so. So please, do well to get the videos and watch them. No need for us to go over them again. You said what?
I said because we are amazing.
I know, right? I know. You guys are good. Trust me. A 2-year-old child in a satisfactory condition periodically presents with a moderate proteinuria, microhematuria. Someone was asking me of differences between nephrotic and nephritic. The next thing is you ask me, I'm going to beat you. That's Eugenia. I remember Eugenia. Ultrasound results, the left kidney is undetectable. The right one is enlarged. The left is undetectable. The right one is enlarged. There are signs of double pilochalasia system. Pilochalasia system. And I'm sure by now you know I'm not good with the kidney. If I can't, don't embarrass myself. But usually when inside the kidney, where we have the collecting duct, it comes to the calyces, then it comes to the how do you call it? Calyces, please. What the calyces drains into that before it drains into the ureter. I've forgotten that system. Charlie, my brain is tired. Yeah. So basically, come again?
Pelvis.
Yes, pelvis. Thank you. Pelvis. So there are signs of double pilochalasia system. What investigation is required to specify the diagnosis? And I think this one, Christopher and either Timothy or something, we had a discussion on why we'll not use this, why we'll use that, isn't it? And we said over here, we are going to use excretory urography because it's happening in a child. It's happening in a child. So this you're thinking of what? The renal pelvis and the calyces or the calyces. The calyces. So to check the pathology there, you have to use what? The excretory urography. And we said, of course, you can also use the retrograde and stuff like that. But more importantly, we use those cases perhaps in adults. I think we came on a conclusion such as that. But of course, if you have more information, please feel free to share. All right, so here we are having what? The excretory urography. So the answer is D. For the last 3 years, a 12-year-old boy has been suffering from stomach ache. 12 years. Sorry. 12-year-old. I thought the stomach ache was 12 years. Okay, for the last 3 years. So 3 years ago, 3 years, I've been having a stomach ache, abdominal distension, nausea, periodical liquid fatty stool. Okay. Gray in color with a rotten smell. On a palpation, the pain is in the epigastrium. Again, I think if you go to my Instagram page, I've started putting in some few content about some anatomies and things like that, and some questions. Some of you are answering them very, 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 very well. Kudos to all of you. We have the 9 divisions, the divisions of the abdomen. There are 9. So epigastrium is there, right, left, lumbar, umbilical, iliac, all of those things. They are all there. Please do well to check them up. Okay. So palpation, pain in the epigastrium level area, discharge, pancreatic joint, and the Carfer's triangle. Guys, the moment they mention positive Mayo Robinson sign, what comes to your mind is what? Case closed, pancreatitis. We've discussed this over and over again.
Pancreatitis.
So when I say that there's insufficiency of the pancreas exocrine function, is suspected. So again, it confirms what you are thinking of. So what method is the most informative for pancreas exocrine function assessment? Exocrine function assessment. And of course, you are going to think of what? The pancreatic elastase. Pancreatic elastase. Pancreatic elastase. And so therefore, your answer here is what? Is D. Pancreatic elastase. So detection of elastase in the feces. And don't forget, the pancreas too also helps in the emulsification of fat, apart from the gallbladder, isn't it? And that's why there's what? Fatty stool. Again, it tells you that fats are not being digested or emulsified properly. So again, everything makes sense, isn't it? That is how medicine is supposed to be. All right. A 34-year-old patient was delivered to a first aid center with open fracture of the lower leg bones. Open fracture of the lower. Guys, what type of condition or complication can result from a fracture of bones or fracture of the lower bones? What condition can come again?
Post-traumatic.
Yes. And what is the good? What is the type of embolism?
Fat.
Fat. Good. Thank you. It's called fat embolism. It's different from thromboembolism. Thrombo means a clot. Fat means a bone. We even have gas. Gas means gas, isn't it? As simple as Charlie, medicine is sweet. Trust me, medicine is sweet. Now, upon examination, the bleeding is stated. Blood flows in pulsating burst. What action should be taken at the stage of medical aid? In other words, there is bleeding. So the focus is the bleeding. Focus here is the bleeding, not necessarily the fracture, but the bleeding. So in this case, what you do, you even schooled me on this question. So definitely you are going for what? For a tourniquet.
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 No.
So your answer is what? Apply a tourniquet
Pressure.
to. Yes. So you have a question. Don't worry. You still have a question?
Yes, Dr. Ba, yes.
Yes.
Actually, because we're talking about pulsating flow of blood.
Yes.
Okay. And knowing fully well that, like, this is mine, because usually when we're having a pulsating flow of blood, you need to apply pressure. Probably, I don't understand the apply. Maybe it's your system.
So applying pressure. Sometimes we use our fingers. Now, usually you are thinking of what artery? You are thinking of one of the arteries being the problem, isn't it? Exactly.
Mm-hmm.
So definitely, a tourniquet is like applying a pressure. Okay. Applying a pressure. Sometimes, locally, we just say you have to use your hand to to apply pressure. But no, that is not enough. You have to use a tourniquet. That's why if you want to draw blood, basically you have to apply some sort of a tourniquet to, make sure that, I don't know how to put it, but basically you apply what? A tourniquet. That's more or less like applying a pressure. Applying a pressure proximal to the place of hemorrhage, because the blood is coming from that area. So don't apply the pressure on the hemorrhage. No. Apply it proximal. And of course, deliver the person to the operating room for, of course,
emergency medicine.
Exactly. So the answer is what? Is E, as simple as that. All right. So don't go and say apply pressure to stop the hemorrhage. It's different from applying a tourniquet to the tie proximally to the place of hemorrhage. Kind of close, but there's a little bit difference.
Dr. Baha, does that mean like above? So basically,
yes, above. Yes, exactly. Above.
Yeah, above
the bleeding site. Above the bleeding site. All right. So your answer is what? E. A 26-year-old patient with affective bipolar disorder has developed a condition manifested by mood improvement, behavioral and sexual hyperactivity. This part is to be good though. Sexual hyperactivity, verbosity, active body language, reduced need for sleep. Which of the following drugs are most effective in this case? Guys, we are having a case of what? A psychiatric disorder. So what do you give? You have to give a neuroleptic drug.
With sedative.
A neuroleptic drug. And the person cannot sleep. So you have to make sure that you have what? A sedative effect inside this neuroleptic drug. Yeah. All right. Hey, what happened? Of course, the answer has come up, but then let's continue to read. An emergency doctor has diagnosed a 32-year-old woman with a generalized convulsive status epilepticus. That is what seizures occurring more than once. The deterioration in the patient condition is caused by a sudden gap in the epilepsy treatment. Okay. Specify the doctor's further tactics. So, of course, epilepsy is kind of a serious emergency. It's usually an emergency situation. Okay. And so, therefore, we have to hospitalize this person in an intensive care unit. So, this one, you already know the answer. So, your answer is definitely what? E. And again, they said what? There was a sudden gap in the treatment. Sudden gap in the means either they defaulted or something like that. All right. A 19-year-old patient complains of dyspnea during physical exertion, often has bronchitis and pneumonia. Cardiac murmur has been observed since his childhood. On auscultation, there is splitting of the second heart sounds over the pulmonary artery, what is arteria. Systolic murmur in the third intercostal space near the left sternum margin. ECG, guys, look, I think I'm going to pose a question like this. ECG shows right bundle branch block. Branch block. What is your provisional diagnosis? So usually the right bundle branch block is simply an electrocardiogram findings that occurs when the physiological electrical conduction system of the heart, specifically in the His-Purkinje system, is altered or interrupted. Usually, it will result in a widened QRS complex. Now, in a right bundle branch block, there is no conduction in the atrial system. There is no conduction in the atrial system. And you and I know that it is the conduction of the atrium that will send signals to the, to the ventricles, isn't it? So that means over here, we are having interarterial septum defect because there's a problem inside the atrium. So we are having what? Interarterial septum defect. All right, this is right bundle branch block. So the answer is what? C. A 30-year-old patient was in a car accident. Okay. He is unconscious, pale, tready pulse. In the middle third, guys, look. This is like the other question we solved. In the middle third of the right thigh, there is an extensive laceration. Laceration is like a deep cut with ongoing profuse external arterial bleeding. What urgent action must be taken to save the life? Guys, what are you thinking about?
Tourniquet above the wound.
Above. But of course, is there? Yes. So we're talking about above. See how you point on yourself. So the answer is what? Is C. So if you understand it, it's always good. Understanding is always key. A 35-year-old patient, 75 male patient, complains of slight pain in the right iliac region. Right iliac region. Guys, who can tell me 2 organs that are found in the right iliac region? Quick. 2. Appendix and what?
Cecum.
Cecum. Or cecum. In from my village, you say cecum, not cecum. Don't do yourself like Americans and British. You're on your own. Cecum. Case closed. Now, the abdominal pain arose 6 days. So again, why I ask this, because already you have an organ in mind, and this will help you when you are going to the next question. The next sentences. Now, the abdominal pain arose 6 days ago and was accompanied by nausea. Surgical examination revealed a moist tank, heart rate 76, BP 130/80, abdomen is soft, slightly painful in the right iliac region on deep palpation. On deep palpation. So you could think about the Bloomberg sign, if I'm correct. You could think about the Bloomberg sign. Okay. Yeah. So now they're saying that the symptoms of peritoneal irritations are sort of doubtful. Good. That means there is no sign of what? Peritonitis. There is no signs of what? Peritonitis. No signs of peritonitis. And although, yes, there's no sign of peritonitis. What else again? In the blood, RBC is 4, blood, hemoglobin is this, WBC, stop neutrophils. Guys, the question is that specify the doctor's further tactics. What are you going to do? So definitely exactly. So definitely you are going to look at for what? Appendicitis comes to your mind. Appendicitis comes to your mind. And if appendicitis, it is usually an emergency case because it can easily develop to what? Peritonitis. It can easily develop to what? Peritonitis. So if you don't treat it quickly, you are, it's going to be a problem in future. So over here, you are going to conduct what? An emergency operation for acute appendicitis. As simple as ABCD. So the answer is what? Is B. All right. On the 10th day postpartum, a parturient woman complains of pain and heaviness in the left mammary gland. Temperature 38, pulse 94. The gland is edematic. Super-external quadrant of the skin is hyperemic. Fluctuation symptoms is absent. Nipples discharge drops of milk when pressed. What is your tactics? What is your tactics? And of course, first, what is your diagnosis? Guys, quick. Oh, diagnosis. Mastitis. Exactly. Exactly. So if you understand it, you really know what you need to do. So if it is an infection, definitely you are going to do what? Antibiotic what? Therapy. Antibiotic what? Therapy. Then immobilization and expression of the breast milk, whatever they want to do. Then of course, you have to also what? Give pain relievers as well. You must give pain, because the person is in pain. You must give what? Pain relievers. So definitely you are looking at what? At D. This is not an abscess where you have to open and then, how do you call it? Drain. No, it's not an abscess yet. It's not an abscess. It's just mastitis. So you see, if you understand it, easy answer to go. An 8-year-old child was hospitalized for fever up to 39 degrees. Guys, those of you who might be feeling a little bit inadequate, these things we have talked about them in our videos, okay? So it's not anything new. We've talked about them, talked. So it's now like in Ghana, they will say it is cocoa. That is porridge. Now, an 8-year-old child was hospitalized for fever up to 39 degrees. Inertness, moderate headache, vomiting. Examination reveals meningeal symptoms. Again, you know your differentials in your head. Hey, medicine is sweet though. Lumbar puncture was performed, like you rightly say. And you see, the obtained fluid had a raised opening pressure. Okay, it was transparent. Cell count of what? 450. But look, it is mainly of lymphocyte. Guys, if it is mainly of lymphocyte, what is the origin of infection? Quick.
Viral.
Oh God. Are you guys sure you guys going to write the same Krok with your mates? It's not fair. It's not fair. Because it's not good. You put know too much.
The way you encourage us.
No. You put know too much. I tell you. You know too much. Because you already know the answer. Even before you end. The question is, what causative agent might have caused the disease in the child? And you know already this is a viral infection. So what is your virus in this question? Even if you don't know, what is your
virus?
Come again?
Enterovirus.
Enterovirus. Oh my Lord.